सकेपछि आफ्टर फ्यु इयर ही विल सफर फ्रम द सेल इन्जरी भनेको के हो हामी पढ्छौँ थर्ड सेमेस्टरको पहिलो च्याप्टर सेल इन्जरी। यो सेल इन्जरी भनेको थाहा होला नि सबैजनालाई हैन। व्हाट इज सेल? सेल इज अ बेसिक फङ्सनल एन्ड स्ट्रक्चरल एन्ड फङ्सनल युनिट अफ लाइफ हैन। इन्जरी भनेको के हुनसक्छ? सेलहरू कम्बाइन भयो भने टिस्यु बन्छ, टिस्युहरू कम्बाइन भयो भने अर्गन बन्छ, र अर्गनहरू मिल्यो भने के हुन्छ? सिस्टम बन्छ, र सिस्टम मिल्यो भने के हुन्छ? ह्युमन बडी बन्छ हैन। त्यसैले सेलमा इन्जरी हुनु भनेको के हो त? एउटा टिस्युमा इन्जरी हुनु हो, एउटा सानो सेलमा इन्जरी भयो, त्यसै गरी बढ्दै 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 धेरै एरियामा धेरै सेलमा यदि इन्जरी भयो भने त्यहाँ टिस्युमा इन्जरी भयो। त्यसै गरी एउटा टिस्युमा इन्जरी भयो, धेरै टिस्युमा। यो सेल इन्जरी भनेको थाहा होला नि सबैजनालाई हैन। व्हाट इज सेल? सेल इज अ बेसिक फङ्सनल एन्ड स्ट्रक्चरल एन्ड फङ्सनल युनिट अफ लाइफ हैन। इन्जरी भनेको के हुनसक्छ? सेलहरू कम्बाइन भयो भने टिस्यु बन्छ, टिस्युहरू कम्बाइन भयो भने अर्गन बन्छ, र अर्गनहरू मिल्यो भने के हुन्छ? सिस्टम बन्छ, र सिस्टम मिल्यो भने के हुन्छ? ह्युमन बडी बन्छ हैन। त्यसैले सेलमा इन्जरी हुनु भनेको के हो त? एउटा टिस्युमा इन्जरी हुनु हो, एउटा सानो सेलमा इन्जरी भयो, त्यसै गरी बढ्दै 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 धेरै एरियामा धेरै सेलमा यदि इन्जरी भयो भने त्यहाँ टिस्युमा इन्जरी भयो। त्यसै गरी एउटा टिस्युमा इन्जरी भयो, धेरै टिस्युमा इन्जरी भयो भने अर्गनमा इन्जरी भयो हैन। अर्गनमा इन्जरी भइसकेपछि एउटा सिस्टममा इन्जरी भयो, र सिस्टममा इन्जरी भइसकेपछि एउटा ह्युमन बडीमै इन्जरी भयो। त्यसैले कुनै पनि इन्फेक्सनबाट पनि इन्जरी हुनसक्छ। कसरी कसरी हाम्रो सेलहरू ड्यामेज हुनसक्छ त? जस्तै कोही मान्छे अब हिँड्दै गयो, लोट्यो, एक्सिडेन्ट भयो, त्यसरी पनि इन्जरी भयो। त्यसै गरी कोही मान्छेलाई इन्फेक्सन भयो हैन, ब्याक्टेरियल इन्फेक्सन, त्यसले गर्दाखेरि पनि इन्जरी भयो। त्यसै गरी आगोले पनि मान्छे जल्न सक्छ, त्यसले पनि इन्जरी भयो। घामले पनि जल्न सक्छ, जस्तै अब युभी रेजहरू चाहिँ एकदमै हार्मफुल हुन्छ, त्यसले पनि इन्जरी हुने भयो हैन। त्यसै गरी अब मेलन्युट्रिसनले गर्दाखेरि, मेलन्युट्रिसन भनेको बुझिन्छ नि हैन, कुनै पनि न्युट्रिएन्ट्सहरू चाहिने पर्ने कुराहरू चाहिँ यदि शरीरमा इम्ब्यालेन्स भएको छ भने त्यसले पनि के हुन्छ त? इन्जरी गराउँछ। डायबिटिज, मेलन्युट्रिसन्स, त्यसै गरी चाहिँ वासी वर्कर, म्यारेस्मस, यो सबै के हो त? इन्जरी भयो, सोर्स हो है। अर्को भनेको कसरी हुनसक्छ? केमिकलबाट। फर इक्जाम्पल, यु आर वर्किङ इन एनी ल्याब, यु गट एक्सपोज विथ द्याट केमिकल्स, इट विल गेट इन्जर्ड। अब त्यसरी नै कुनै 10 वर्षसम्म कुनै कम्पनीमा काम गर्न थाल्यो, फार्मास्युटिकल कम्पनीमा काम गर्न थाल्यो, केही वर्षपछि तुरन्तै त ड्यामेज हुँदैन, तर के हुन्छ त? हाम्रो बडीमा के क्यापेसिटी हुन्छ? एब्जर्प्सन गर्ने क्यापेसिटी हुन्छ। जस्तै हामीले सनसँग एक्सपोज भइसकेपछि हाम्रो बडीले के गर्छ? सनको रेजलाई एब्जर्ब गर्छ। एब्जर्ब गरिसकेपछि के गर्छ त? हाम्रो भिटामिन डी सेन्थिसिस गर्छ, र हाम्रो हड्डीहरू स्ट्रङ हुन्छ। त्यसै गरी जसरी चाहिँ स्किनले, बडीले चाहिँ रेजहरू एब्जर्ब गर्छ, त्यसैले चाहिँ बडीले के गर्छ? केमिकलहरू पनि एब्जर्ब गर्न सक्छ। त्यसैले फार्मास्युटिकल कम्पनीमा काम गर्ने मान्छेहरू के हुन्छ त? त्यो इन्हेल गरेको हुन्छ त्यो केमिकल। इन्हेल गर्दै 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 जाँदा के हुन्छ त? लङ्सको सेलहरू ड्यामेज हुन्छ। लङ्स सेल ड्यामेज भइसकेपछि आफ्टर फ्यु इयर ही विल सफर फ्रम द सिओपिडी, एस्थमा, त्यस्तो किसिमको हुन्छ। केमिकलबाट भयो, त्यो विभिन्न सोर्सहरू भयो। सो यु विल सी वान बाई वान सेल इन्जरी। फर्स्ट अफ अल विल सी द डेफिनेसन अफ अ सेल इन्जरी। व्हाट इज सेल? सेल इज डिफाइन्ड एज द स्ट्रक्चरल, फङ्सनल एन्ड बायोलोजिकल युनिट अफ अ लाइफ है। र यहाँनिर सेल के बनेको छ? टिस्यु बनेको छ। व्हेन ग्रुप अफ अ सेल कम्बाइन टुगेदर इट फर्म अ टिस्यु, and group of tissue combined together it form a organ combined together form a system, and system form a organism or human body। विशेष गरी सेल इन्जरी भनेको दुई प्रकारको हुन्छ। एउटा चाहिँ रिभर्सिबल सेल इन्जरी, एउटा चाहिँ इरिभर्सिबल सेल इन्जरी। कुनै पनि नर्मल सेल भनेको त्यो सेलमा कुनै पनि किसिमको इन्फेक्सन भएको छैन, नर्मली काम गरिरहेको छ। सेलको काम के हो? सेलको फङ्सन के हो? त्यो काम चाहिँ गरिरहेको छ नर्मली, भनेको इन homeostasis or steady state, means without any infections, without any complications, cell is working. For example, you don't have any problem, means your cell, your organ, your system, your body is in normal conditions। यदि यो नर्मल सेल चाहिँ कुनै पनि इन्जुरियस स्टिमुलससँग एक्सपोज भयो भने त्यहाँनिर सेल इन्जरी हुन्छ। र यो सेल इन्जरी दुई प्रकारको हुन्छ, एउटा चाहिँ रिभर्सिबल, एउटा चाहिँ इरिभर्सिबल। रिभर्सिबल सेल इन्जरी भनेको के हो त? देयर इज माइल्ड इन्जरी हुन्छ, नामैबाट प्रश्न हुन्छ। रिभर्सिबल भनेको चाहिँ रिभर्स हुने, सेल आज ड्यामेज भयो नर्मल कन्डिसनमा आयो भनेपछि दिस काइन्ड अफ इन्जरी नन एज रिभर्सिबल इन्जरी। माइल्ड किसिमको इन्जरी मात्रै हुन्छ। यहाँ हेर्न सकिन्छ इन्जरियस स्टिमुलस सेल इन्जरी, यदि माइल्ड किसिमको इन्जरी छ भने इट्स ए रिभर्सिबल। तर कुनै कुनै बेला के हुन्छ त इन्जरी यस्तो भइदिन्छ कि सिभियर टाइप भइदिन्छ। सिभियर भइसकेपछि त्यहाँको सेल्सहरू मर्छ, ड्यामेज हुन्छ, अर्गन खतम हुन्छ। विशेष गरी एक्सिडेन्टमा कोही कोही मान्छे ठुलो एक्सिडेन्ट पऱ्यो भने के हुन्छ त उसको टाउकोमा चोट लाग्यो भने के हुन्छ त मान्छे पागल हुन्छ, अथवा चाहिँ कुनै खुट्टा काट्नुपर्ने अवस्था हुन्छ होइन। त्यो अवस्थामा के हो त सिभियर टाइपको इन्जरी भयो र यो त्यो भनेको चाहिँ इरिभर्सिबल हुन्छ। यदि सिभियर टाइपको इन्जरी भयो भने द्याट इज इरिभर्सिबल। इरिभर्सिबल सेल इन्जरी भयो भने त्यहाँनिर के हुन्छ फाइनली द अर्गन्स द सेल द टिस्यु विल डाई। रिभर्सिबल सेल इन्जुरीमा चाहिँ डेथ हुँदैन, नर्मलमा आउँछ। तर इरिभर्सिबल सेल इन्जुरीमा के हुन्छ त त्यो सेलहरू चाहिँ मर्छ, डाई हुन्छ र यो चाहिँ दुईवटा प्रक्रियाबाट चाहिँ डेथ हुन्छ। एउटा नेक्रोसिस र चाहिँ एपोप्टोसिस। यसको छुट्टै च्याप्टर छ, एउटा एपोप्टोसिसको छुट्टै छ, नेक्रोसिसको पनि छुट्टै छ, यो हामी पढ्छौँ। र अब यहाँ तलतिर हेरौँ, यहाँ स्ट्रेस लेखेको छ, एडेप्टेसन लेखेको छ। र कुनै पनि सेलमा यदि इन्जरी भइसकेपछि इन्जर भएको सेललाई चाहिँ रिकभर गर्न कोसिस गर्छ। अनवान्टेड इन्भाइरोमेन्ट, इन्जरियस इन्भाइरोमेन्ट होइन, जुन इन्भाइरोमेन्ट आयो त्यो इन्भाइरोमेन्टलाई कुपअप गर्नको लागि आफूले एडेप्ट गर्न कोसिस गर्छ। यदि कुनै कुनै सेल यदि चाहिँ एडेप्ट भयो भने सेल इन्जरी हुन पाउँदैन। बिफोर सेल इन्जरी ट्राई टु एडेप्ट द्याट स्ट्रेसफुल इन्भाइरोमेन्ट बाई एडेप्टेसन्स। When it will fail, that time it will cause the cell injury, and there is two types of cell injury. One is a reversible cell injury, next is a irreversible cell injury. If the injury is a mild type, it is a reversible. If the injury is severe type, it is a irreversible. And irreversible cell injury means it is a cell death, and cell death happen by two process. One is a necrosis and next is a apoptosis. Right? अब हामी हेर्छौँ definition. What is cell injury? Cell injury is defined as a change in a external and internal environment of a cell because of an stress that has been encountered by the cell. प्रश्न हुन्छ causes of cell injury यो आइसकेछ। एकचोटि फेरि हेरौँ, there may be acquired causes and one is a genetic causes. अब हामी हेर्छौँ acquired causes र acquired causes मा के हुन सक्छ त cell injury caused by a hypoxia or ischemia. What is hypoxia? Hypoxia भनेको के हो? Decrease the supply of oxygen, right? When there is hypoxia, you will not get enough oxygen. Then that time what happen? You will feel difficulty in breathing. What is ischemia? Ischemia भनेको के हो? Less supply of blood. हामीलाई थाहा छ र सेल्सलाई बाँच्नको लागि के चाहिन्छ? अक्सिजन चाहिन्छ। त्यो अक्सिजन कहाँबाट पाउँछ? ब्लड सप्लाईबाट पाउँछ। किनभने त्यो ब्लडमा के हुन्छ? यसलाई सेल्सलाई चाहिने पर्ने कुराहरू सबै कुरा हुन्छ। उसमा चाहिने सोडियम, पोटासियम, क्लोरिन, आयोडिन होइन जति पनि कुराहरू छ, अक्सिजन, त्यो सबै कुराहरू चाहिँ ब्लड सप्लाई ब्लडमा पाउँछ। र यो ब्लड सप्लाई यदि चाहिँ भएन भने सेलमा त्यो सेलहरू मर्छ। जस्तै किडनीलाई पनि ब्लड सप्लाई चाहिन्छ, हार्टलाई पनि ब्लड सप्लाई चाहिन्छ, अनि ब्रेनलाई पनि ब्लड सप्लाई चाहिन्छ। जस्तै कि यदि ब्लड सप्लाई पुगेन भने के हुन्छ? हाम्रो चेस्ट पेन हुन्छ। जस्तै हार्टमा यदि चाहिँ इनफ एमाउन्ट अफ ब्लड पुगेन भने के हुन्छ त त्यहाँको सेलहरू चाहिँ मर्न थाल्छ। तर हामी भन्छौँ मायोकार्डियल इन्फ्र्याक्सन भन्छौँ है। त्यसै गरी किडनीमा पनि के चाहिन्छ? ब्लड सप्लाई चाहिन्छ है। त्यो ब्लड सप्लाई भएन भने हाम्रो किडनीहरू फेल हुन्छ। यदि चाहिँ कुनै पनि सेल्सले बडीमा रहेको कुनै पनि सेल्सले यदि अक्सिजन पाएन अथवा चाहिँ त्यसलाई भन्छ हाइपोक्सिया अथवा ब्लड सप्लाई पुगेन भने त्यसलाई भन्छ इस्केमिया। त्यति बेला के हुन्छ त सेल डेथ हुन्छ। अर्को छ फिजिकल फ्याक्टर छ, केमिकल एजेन्ट छ, माइक्रोबियल एजेन्ट छ, इम्युन सिस्टम छ, न्युट्रिसनल इम्ब्यालेन्स छ। त्यसै गरी के छ त साइकोलोजिकल फ्याक्टर छ। अब एउटा एउटा हामी हेर्छौँ है। हाइपोक्सिया र इस्केमियाबाट कसरी सेल डेथ हुन्छ, सेल इन्जुरी हुन्छ। हाइपोक्सिया र इस्केमियाबाट कसरी सेल इन्जुरी हुन्छ यहाँ मैले भनिसकेको छु पहिले पनि। द सेल अफ अ डिफ्रेन्ट टिस्युज स्पेसली रिक्वायर्ड अक्सिजन। कुनै पनि सेल्सलाई बाँच्नको लागि अक्सिजन चाहिन्छ र अक्सिजन के को लागि चाहिन्छ त टु जेनेरेट द एनर्जी एन्ड perform a metabolic functions. As we know that blood act as a carrier of oxygen विदिन द बडी भनेको ब्लड र अक्सिजन दुइटै चाहिँ एकअर्कामा कनेक्टेड छन् ब्लड सप्लाई कम हुनु भनेको के हो त अक्सिजनको सप्लाई घट्नु हो सो नेक्स्ट इज द सेल इन्जरी क्यान अकर्स इफ द बडी cells are not getting enough amount of blood supply or the body cells are getting enough supply of oxygens. So what is termed ischemia? Reduced supply of blood is termed as a ischemia and the reduced supply of oxygen is known as a hypoxia. यदि चाहिँ hypoxia र ischemia भयो भने पनि त्यहाँनिर सेल इन्जुरी हुन सक्छ. नेक्स्ट इज अ फिजिकल फ्याक्टर. फिजिकल फ्याक्टर भन्नाले अब कुनै पनि हुन सक्यो मेकानिकल ट्रमा एक्सिडेन्ट कुनै मान्छे बाइक चलाएर गइरहेको थियो बाटोमा चाहिँ पल्ट्यो लड्यो ठोक्कियो त्यहाँनिर चाहिँ ब्लिडिङ सुरु हुन थाल्यो द्याट इज अ इक्जाम्पल अफ अ मेकानिकल ट्रमा ओर अ फिजिकल फ्याक्टर. थर्मल ट्रमा आगोबाट जल्यो इलेक्ट्रिसिटीबाट जल्यो अथवा कुनै चिजबाट जल्यो कुनै मान्छे आगोबाट जल्छ नि त्यति बेला पनि मान्छेहरू मर्छ नि सेलहरू ड्यामेज हुन्छ थर्मल ट्रमा भन्छ त्यसलाई करेन्ट लगाएर मान्छे मर्छ. त्यसै गरी रेडिएसनबाट पनि हुन्छ युभी रेजहरू एक्सरेजहरू. अर्को भनेको माइक्रोबियल एजेन्टबाट हुने इन्जुरीहरू ब्याक्टेरिया भाइरस फङ्गाई प्रोटोजोआ प्यारासाइट्स. ल एउटा इक्जाम्पल भन त ब्याक्टेरियाबाट लाग्ने रोगहरू. रन्जित ल एउटा इक्जाम्पल भन ब्याक्टेरियाबाट लाग्ने रोग इन्फेक्सन्स ब्याक्टेरियल इन्फेक्सनको एउटा इक्जाम्पल भन त. टिबी ल ओके गुड टिबी इज द बेस्ट इक्जाम्पल बुझ्नको लागि सजिलो छ. ब्याक्टेरियल माइकोब्याक्टेरियम ट्युबरक्लोसिस एउटा इक्जाम्पल लिन सक्छौँ. अर्को ह्युमन सिस्टम कुनै कुनै मान्छेहरू एकदमै सेन्सिटिभ हुन्छ लाइक इफ दे विल इट सम काइन्ड अफ भेजिटेबल्स ओर समटाइम्स इफ दे विल टेक सम मेडिसिन्स एक्सपोज टु सम काइन्ड्स अफ स्मेल्स देयर विल बी हाइपर सेन्सिटिभ रियाक्सन्स एन्ड दे विल गेट एलर्जिज अटो इम्युन डिसअर्डर लाइक डायबिटिज अर्थराइटिस. न्युट्रिसनल इम्ब्यालेन्सबाट पनि सेल इन्जुरी हुनसक्छ. अघि पनि भनेको मैले इक्जाम्पल के हुनसक्छ malnutrition है. सो डिफिसियन्सी ओर एक्सेस अमाउन्ट अफ न्युट्रिसन both of these states are termed as a nutritional imbalance. Like if you will take a excess diet, it will cause that obesity. Examples are there: marasmus, anemia, kwashiorkor, and the increased amount of nutrients lead to a heart disease, obesity. यो भनेको न्युट्रिसनल इम्ब्यालेन्स भयो भने पनि के हुन्छ त इन्जुरी हुन सक्छ. यो सबै इक्जाम्पल भयो हाम्रो न्युट्रिसनल इम्ब्यालेन्सको. र साइकोलोजिकल फ्याक्टरले कसरी सेल इन्जुरी गर्छ त गर्छ र केही आइडिया छ? So you can see here there is one psychological factor that may enhance the cell death. Like there are no specific biochemical or morphological changes in a common acquired mental disease. However, problem of drug addictions, alcoholism, smoking result various organic disease such as liver disease, lung cancer, pepic ulcer, hypertension. जस्तै कुनै कुनै बेला के हुन्छ त मान्छेको एउटा सोच हुन्छ कुनै टेन्सन छ कुनै तनाव भएको छ भने उसले गएर चुरोट खान्छ गएर रक्सी खान्छ डिप्रेसनलाई हटाउनको लागि. त्यति बेला के हुन्छ त मान्छे बिस्तारै बिस्तारै के हुन्छ त जडाया हुन्छ. जडाया भइसकेपछि के हुन्छ लिभर खराब हुन्छ हैन अल्सर हुन्छ. यसले गर्दाखेरि मान्छेहरूलाई एउटा साइकोलोजिकल फ्याक्टरले पनि के हुन्छ त सेल डेथहरू चाहिँ गराउन सक्छ. यो पनि एउटा के हो त कजेस अफ सेल इन्जुरी. प्याथोजेनेसिस सेल इन्जुरीको दुईटा छ एउटा रिभर्सिबल र इरिभर्सिबल सेल इन्जुरी. डिफिनेसन के हो त यसको प्याथोजेनेसिस मिन्स द म्यानर अफ डेभलपमेन्ट अफ अ डिजिज कसरी स्टेप बाई स्टेप कसरी चाहिँ डिजिजहरू चाहिँ हुन्छ. जेनेसिस द वर्ड जेनेसिस मिन्स जेनेरेसन प्याथो मिन्स प्याथोजेन है कुनै पनि चाहिँ इन्फेक्सन कुनै पनि डिजिज कुन म्यानरले चाहिँ ग्रोथ हुन्छ त्यसलाई हामी भन्छौँ प्याथोजेनेसिस. सो हियर विल डिस्कस अबाउट अ रिभर्सिबल सेल इन्जुरी and irreversible cell injury. The first is a reversible cell injury. Okay, so hypoxia भनेको के हो पहिला यो बुझ्नु पर्यो. इस्केमिया भनेको के हो यो बुझ्नु पर्यो. हाइपोक्सिया भनेको के हो त इट्स अ डिक्रिज द सप्लाई अफ अक्सिजन. इस्केमिया भनेको द्याट डिक्रिज द सप्लाई अफ ब्लड हैन. यदि इस्केमिया हुन्छ भने त्यहाँ डेफिनेटली नै हाइपोक्सिया हुन्छ किनभने अक्सिजन क्यारी गर्ने भनेको ब्लडले हो. ब्लड सप्लाई हुनु भनेको के हो त अक्सिजन सप्लाई हुनु हो. यदि कुनै पनि सेल्सले कुनै पनि अर्गनले इनफ अमाउन्ट अफ ब्लड पाएन भने देयर इज अ डिक्रिज इन द एटिपी फर्मेसन्स. एटिपी भनेको के हो त एनर्जी हो. यदि हाइपोक्सिया भयो भने इस्केमिया भयो भने अक्सिजनको लेभल घट्छ. अक्सिजनको लेभल घट्ने बित्तिकै के हुन्छ त एटिपी पनि घट्छ. ओके सो दिस इज वान इम्पोर्टेन्ट पोइन्ट. अनि एटिपी घट्ने बित्तिकै एटिपी भनेको चाहिँ एनर्जी नै हो. यो घट्ने बित्तिकै तीनटा चेन्जेसहरू आउँछ हाम्रो सेल्समा. एउटा के हो त इन्ट्रासेलुलर पिएच चाहिँ डिक्रिज हुन्छ. अर्को चाहिँ सोडियम पम्प चाहिँ ड्यामेज हुन्छ. अर्को भनेको चाहिँ डिक्रिज द प्रोटिन सिन्थेसिस. यी तीनटा चेन्ज भइसकेपछि त्यहाँनिर के हुन्छ स्ट्रक्चरहरू चाहिँ चेन्ज आउँछ है स्ट्रक्चरहरूमा चाहिँ चेन्जेसहरू आउँछ फङ्सनल चेन्जेसहरू आउँछ फङ्सनल चेन्जेस भनेको जुन काम गर्नुपर्ने हो सेल्सले त्यो काम गर्न सक्दैन माइट बी डिक्रिज द फङ्सन अफ अ सेल्स पार्टिकुलर अर्गन्स बिकज अफ चेन्ज इन द स्ट्रक्चर त्यसले गर्दाखेरि सेल इन्जुरी हुन सक्छ So reversible cell injury because of hypoxia. So if there is a hypoxia and ischemia is of short duration, केही समयको लागि मात्रै 10 minutes 20 minutes then that time it will be reversible after restoring the blood circulation. तर यदि चाहिँ लामो समयसम्म राख्यो भने के हुन्छ त अर्गनहरु फेल हुन्छ like a heart attack like a example coronary artery occlusion. So it is very important that we should restore the abnormal condition as soon as possible. So we can see here if there is a decrease in oxygen supply or blood supply, there is a decrease in ATP synthesis and there is a reduce the intracellular pH, damage the plasma membrane potassium pump, decrease the protein synthesis, there will be changes in function of our cells and finally there is change in structures and cause the cell death or injury cell injury. अब यहाँ हेरौँ decrease the cellular ATP के हुन्छ त ATP is essential for a function of a membrane transport, protein synthesis, lipid synthesis र phospholipid metabolism. जति पनि मेटाबोलिजमहरु छ जस्तै कि membrane transport को लागि, protein synthesis को लागि, lipid synthesis को लागि र phospholipid metabolism को लागि चाहिँ हामीलाई ATP को आवश्यकता पर्छ र यो ATP पाएन भने यी कुराहरु हुन सक्दैन यदि यो भएन भने हाम्रो चाहिँ सेल्सहरुले चाहिँ एब्नर्मल फंक्सन सुरु गर्छ. सो हाउ वी क्यान जेनरेट एटीपी बाइ टु सोर्स वान इज अ एरोबिक रेस्पिरेसन अर्को भनेको चाहिँ एनारोबिक रेस्पिरेसन. डिफरेन्स के हो त एरोबिक र एनारोबिक. एरोबिक भनेको रिक्वायर्ड अक्सिजन इन प्रेजेन्स अफ अक्सिजन जेनरेसन अफ एटीपी अनि एनारोबिक रेस्पिरेसन भनेको चाहिँ इन एब्सेन्स अफ अक्सिजन र यसमा चाहिँ यो हार्मफुल हुन्छ. फेरि कुन हार्मफुल हुन्छ एनारोबिक रेस्पिरेसन चाहिँ सुरु भयो भने के हुन्छ लास्टमा ल्याक्टिक एसिड फर्मेसन हुन्छ. द्याट इज भेरी हार्मफुल. ल्याक्टिक एसिड फर्मेसन भइसकेपछि इट्स हार्मफुल फर अ सेल्स. इस्केमिया एन्ड हाइपोक्सिया both limit the supply of oxygens to the cell due to the which generation of ATP decreases. त्यसै गरी अर्को के छ त reduce intracellular pH घट्यो भने के हुन्छ त when oxygen is not supplied to the cell in proper amount then aerobic respiration switch to anaerobic in order to generate the ATP but in turn what happens and this result in depletions of glycogens that causes accumulation of lactic acids that involves the lowering the intracellular pH. कुरा बुझेको छ अक्सिजन कम भयो त्यसपछि एनारोबिक रेस्पिरेसन सुरु भयो एटीपी बनाउनको लागि तर चाहिँ एटीपी त बन्यो तर ल्याक्टिक एसिड फर्मेसन भयो बिकज अफ फर्मेसन अफ ल्याक्टिक एसिड इट विल डिक्रिज द पीएच अफ सेल्स. इन्ट्रासेलुलर पीएच चाहिँ डिक्रिज भयो है. अर्को भनेको चाहिँ सोडियम पम्प हुन्छ सेल मेम्ब्रेन्समा त्यो पनि ड्यामेज गर्छ. कसरी एज सुन एज द अमाउन्ट अफ एटीपी डिक्रिजेस इन द सेल द एक्टिभिटी अफ एटीपीएस इन्क्रिज एन्ड दिस एटीपीएस इन्टरफेयर विथ द मेम्ब्रेन्स रेगुलेटेड प्रोसेस एन्ड दिस रिजल्ट इन द intracellular accumulation of sodium and the diffusion of potassium over the out of the cell and accumulation of sodium in cell causes the increase the level of intracellular water in order to maintain the isosmotic conditions. Cell जहाँनिर सोडियम हुन्छ त्यहाँनिर वाटर पनि हुन्छ. पानी र नुन if you will take more salt you will drink more water. So what happens there is accumulation of sodium inside the cell and this will trap the water. त्यसले गर्दाखेरि सेलहरु swelling हुन्छ. So protein synthesis if there is hypoxia there is decrease in ATP and it decreases the protein synthesis. So as a result of hypoxia ribosomes are detached from the granular endoplasmic reticulum and the polysomes are degraded to the monosomes and this process result the decrease the protein synthesis. यही कुराले गर्दाखेरि दुईटा वर्ड जम्मा छ हाइपोक्सिया भयो रेटिकुलमबाट एन्डोप्लाज्मिक रेटिकुलमबाट चाहिँ राइबोसोम डिट्याच भयो र चाहिँ यो पोलिसोम्स मोनोसोम्स भयो त्यसले गर्दाखेरि चाहिँ प्रोटिन सिन्थेसिस डिक्रिज भयो है एन्ड इफ देयर इज नो प्रोटिन देन सेल विल स्टार्ट टु डाई. अर्को भनेको अब यी तीनटा कुराले गर्दाखेरि के हुन्छ त फंक्सनहरु अल्टर भइदिन्छ. सो नेक्स्ट इज अ फंक्सनल चेन्जेस. रिभर्सिबल सेल इन्जुरी मे रिजल्ट इन अ फंक्सनल डिस्टर्बेन्स. एक्जाम्पल मायोकार्डियल कन्ट्राक्टिबिलिटी सेज विथ इन 60 सेकेन्ड्स बट क्यान बी रिभर्स सर्कुलेसन इज अ रिस्टोर. के चेन्जेसहरु आउन सक्छ त यहाँनिर एन्डोप्लाज्मिक रेटिकुलममा के हुन्छ स्वेलिङ हुन्छ. स्वेलिङ अफ एन्डोप्लाज्मिक रेटिकुलम and because of swelling there will be detachment of ribosomes. There will be swelling of mitochondria. What is mitochondria? Powerhouse of a cell. It will generate the energy. और mitochondria अब swelling भएको छ भने के हुन्छ there will no energy formations. अर्को भनेको प्लाज्मा मेम्ब्रेन्स मा के हुन्छ माइक्रोभेलाई भन्ने जुन छ है यो चाहिँ लस भइदिन्छ एन्ड देयर विल बी फोका प्रोजेक्सन अफ साइटोप्लाज्म ब्लेब्स अकर. अर्को भनेको के छ न्यूक्लियस. देयर इज अ सेग्रिगेशन्स अफ ग्रानुलर एन्ड फाइब्रिलर component of a nucleus and reductions in the RNA synthesis. So this was about रिभर्सिबल सेल इन्जुरी, इरिभर्सिबल सेल इन्जुरी. इट्स अल्सो बिकज अफ अ हाइपोक्सिया एन्ड इस्केमिया. यसमा अलिकति फरक छ है. सो व्हेन देयर इज अ हाइपोक्सिया एन्ड इस्केमिया, व्हाट ह्यापन? देयर विल बी डिक्रिज इन द सिन्थेसिस अफ एटीपी. यो थाहा होला, यो रिभर्सिबलमा आइसक्यो. नेक्स्ट, देयर विल बी फर्मेसन अफ टक्सिक रेडिकल्स. देयर इज अ डिक्रिज द एटीपी सिन्थेसिस as well as there is a formation of a toxic radicals. When there is a decreased oxygen supply or blood supply, that will cause increase the cytosolic calcium ion concentrations. When there is hypoxia, three things is happening. Number one, decrease the ATP synthesis, and next is a formation of a toxic radical. Next, there is increase the cytosolic calcium ion concentrations. When there is a decrease in ATP, there will be decrease in the synthesis of a membrane and a phospholipids. One by one here. When there is decrease in a ATP synthesis, there is decrease in a synthesis of a membrane and phospholipids. When there is a decrease in phospholipid synthesis, what happened? The loss of a membrane phospholipid increase, and similarly there will be breakdown of lipids, and this both process will cause the membrane damage. When there is membrane damage, there will be liberation of enzymes, that is intracellular enzymes. So when there is liberation of this kind of enzymes, it will cause the nuclear changes of the cell. Similarly, it will cause the cell death. Irreversible cell injury को final outcome भनेको के हो त? Cell death हो. अर्को भनेको चाहिँ serum enzyme activation. अब अर्को पार्ट हेरौँ अब हामीले. नेक्स्ट इज इन्क्रिज द साइटोसिलिक क्याल्सियम आयन कन्सन्ट्रेसन्स. व्हेन देयर इज इन्क्रिज द क्याल्सियम कन्सन्ट्रेसन आयन, इट विल कज द एक्टिभेसन अफ अ phospholipids and activation of a protease. This is for a calcium ion concentration. Right? When there is a hypoxia and ischemia, there will be increase the cytosolic calcium ion concentrations, and because of this increase of amount of calcium ion concentration, it causes the two activation of a enzyme, that is one is phospholipase activations, next is a protease activations. And because of activation of phospholipase, it will cause the lipid breakdown product, and it will follow same thing. Lipid breakdown product, membrane damage, liberation of intracellular enzyme, the cell death. Next, when there is activation of protease, there will be cytoskeletal injury, and also it will cause the membrane damage, liberation of intracellular enzymes and cell death. अब हामी हेर्छौं टक्सिक अक्सिजन रेडिकल्स. हाइपोक्सिया र इस्केमिया भइसकेपछि टक्सिक अक्सिजन रेडिकल बन्छ, लाइक अ superoxides or hydrogen peroxides. There will be lipid peroxidations and DNA damage, and when there is DNA damage, then there is a membrane damage. So ultimately DNA damage will cause the membrane damage, and it will cause the liberation of intracellular enzyme, and it cause the cell death. यति नै हो इरिभर्सिबल सेल इन्जुरीको प्याथोजेनेसिस बिकज अफ हाइपोक्सिया एन्ड इस्केमिया. यसैलाई चाहिँ अब एक्सप्लेन गरेको छ ल्याङ्ग्वेजमा, त्यो अब आफै पढेर बुझिन्छ है. यही कुरालाई एक्सप्लेन गरेको छ. केही कन्फ्युजन छ दिपेन्द्र? ल भन त तिमीले यो फ्लो चार्ट. थ्याङ्क यू.
So welcome guys in next tutorial part of this video on apoptosis, and we have already discussed about the definitions of apoptosis, and we know that apoptosis can be defined as a natural biological process of a programmed cell death in which cells destroy themselves for maintaining the smooth functioning of the body. So basically cell death can take place by two processes. One is by apoptosis and one by necrosis. Already we have discussed about a necrosis, which is a uncontrolled death of a cells, and now today we'll discuss about a different pathway for apoptosis, which is a programmed death of a cells. Okay, we know that this apoptosis is a biological process which occurs in all organism, including plant and animals, and this apoptosis removes the cells from the organism that should no longer be part of a organism. So this apoptosis play a major role in the development of humans and in developing and maintaining the healthy human system. And on an average, we find that about 50 to 80 billion cells die every day in a human adult due to apoptosis. And during this biological process or apoptosis, the infected cell, precancerous cells and other cells are eliminated successfully and maintain the balance of a cell in the human body. Therefore, this apoptosis are essential process that is responsible for a normal development of a cell cycle maturation, and maintaining the regular function and activities of a cells. This is some benefits of a apoptosis. We can take some example like a loss of a tail of a tadpole when it develops into a frog. So this is one example of a apoptosis. So in today's tutorial part, we will discuss in much more detail about a apoptosis pathway. So we can see here there are two pathways basically in apoptosis. We have a extrinsic pathway, and next we have a intrinsic pathway. So extrinsic pathway means the signal is coming from the outside of the cell, where intrinsic pathway means signal is coming from inside of the cells. So these are the two major pathways where apoptosis can take place, either via intrinsic pathway, either via intrinsic pathway. So we will discuss in much more detail about a intrinsic pathway in today's video. So intrinsic pathway is also known as a mitochondrial pathway. So let me put a laser. So intrinsic pathway is also known as a mitochondrial pathway. Why it is called a mitochondrial pathway? Because intrinsic pathway, they target a mitochondria to complete this process. Okay, so that's why the intrinsic pathway is also known as a mitochondrial pathway. This intrinsic pathway triggers apoptosis in response to the internal stimuli such as a biochemical stress, DNA damage, or a lack of some kind of growth factors or hormones. And basically this pathway is modulated by two groups of molecules, that is a PAX protein and a BCL2 proteins. Okay, and these groups of molecules determine whether a cell will survive or undergo a apoptosis in response to the stimuli. So let's take example. This is a one kind of a cell. So definitely, if it is a cell, means there should be a mitochondria, and also we have told that intrinsic pathway mainly targets the mitochondria. So this is a mitochondria you can see in figure on my screen. So let's assume there is a DNA damage or some kinds of stress inside the cell. So since it is an intrinsic pathway, means from inside the cell there will be generation of a signal. So there are some kind of a signaling proteins like a ATM and CSK. These are a sense protein, or we can say these are a signaling protein. They will get a sense that the DNA has been damaged. So once this ATM and CSK are activated, they will activate P53 proteins. Okay, so when these P53 proteins are activated, they are very dangerous. So this activated P53 protein will activate the Bax proteins, and the most important features of a Bax protein is that they will target the mitochondria. So they will target the mitochondria, and they will start to create a pores inside the mitochondria. They will start to make a holes. Okay, they will start to make a holes inside the mitochondria. So once there is a formation of a hole or formation of a pores inside the mitochondria, all the cytochrome C that is inside the mitochondria, they will leak out. They will come out to the cytosol. So all cytochrome C will come out to the cytosol by this pores that is created by a Bax protein. So once this cytochrome C will come out in cytosol, they will pair with another protein known as a EPAF1 protein. So EPAF1 protein and cytochrome C, they will pair together and they will activate another protein known as a procaspase 9. So once these procaspase 9 are formed, they will convert into a active procaspase 9. Okay, so active procaspase 9, they will activate another proteins known as a procaspase 3. Procaspase 3. So once these procaspase 3 are activated, they will activate or they will convert into a active caspase 3. So this active caspase 3 will play a major role in intrinsic pathway. So once this active caspase 3 are formed, they will activate two enzymes. One is nuclease and next is protease. So let's talk about a basic concept about a nuclease enzyme, how it get activated. So let's assume this is a nuclease enzymes, and always these nuclease enzymes are bind with some kinds of a inhibitor. So let's take this is a inhibitors. This green part what you are seeing, let's assume this is a inhibitor. So this nuclease are inhibited by inhibitors. They will bind with these inhibitors, but once this active caspase 3 are formed or activated, they will target these inhibitors. So these inhibitors are destroyed, are damaged by the active caspase 3. So when this active caspase 3 will damage this nuclease inhibitors, this nuclease enzyme remain free, and once they become free, they will be activated, and once they are activated, they will cause the nucleic acid breakdowns. So when this nucleic acid breakdown means what happened, all the cells, all the microtubules DNA that will be engulfed by the macrophage, and some kinds of a phagocytic cell will come and they will eat that cell and cause the cell death. So in other hand, this protease enzyme will also help in a cell death. How? Because of a protease enzyme, it will cause the protein breakdown. So when there is protein breakdown inside the cell, that will cause the cell death of a organelles. So in this way intrinsic pathway get complete. So once again I would like to do a revision. So when there is a DNA damage, there will be secretion of signaling proteins like ATM, CSK. So when ATM, CSK are secreted or activated, they will activate p53 proteins. So once this p53 proteins are activated, they will activate Bax protein, and this Bax protein will target mitochondria. They will create holes inside the mitochondria, and from these holes all the cytochrome C will come to the cytosol, and they will pair with the EPAF1 protein. And once this cytochrome C and EPAF1 protein pairs together, they will activate procaspase 9, and this procaspase 9 will convert into active caspase 9, and this active caspase 9 will convert or liberate or activate procaspase 3, and this procaspase 3 will get activated into active caspase 3. And once this active caspase 3 are formed, they will activate two kinds of enzymes. One is nuclease, next is protease, and they will release a nuclease enzyme, or they will activate the nuclease enzyme by inhibiting the nuclease inhibitors. They will target these inhibitors, they will destroy these inhibitors, and they will make a nuclease free to activate. Once these nucleases are activated, they will cause the nucleic acid breakdown, and protease will also cause a protein breakdown, and finally this will cause a cell death. So this way intrinsic pathway or mitochondrial pathway will get complete. So in next video we'll talk about extrinsic pathway in more detail. So guys, if you like this video, kindly like, comment and subscribe my channel. Thank you. We'll see in next video.
Welcome guys in next tutorial of type 1 diabetes mellitus. So today we'll discuss about diabetes mellitus. So let's talk about the definitions of a diabetes. Diabetes mellitus is a metabolic disorder in which the body ability to produce or response to insulin is impaired, resulting in a elevated blood glucose level. And the medical term of a high blood glucose level is a hyperglycemia. The diabetes mellitus come from a Greek word that is diabetes, means to pass through, and the Latin word that is mellitus means a sweet. So this makes sense as a sweet glucose pass through the body and into the urine in a diabetes mellitus. So diabetes mellitus can be classified into two types, that is type 1 diabetes mellitus and type 2 diabetes mellitus. So this lecture will focus on a type 1 diabetes, and as I told you that type 1 diabetes is an autoimmune disease in which the body immune system attacks the insulin producing cell of our pancreas. So as a result, the pancreas produce a very little to no insulin and blood glucose level will be increased. So although type 1 diabetes typically develops in younger age group, but the peak age of a diagnosis is approximately 13 years old. So adult can also develop type 1 diabetes later in their life. Okay, and if we'll see, type 1 diabetes is less common than type 2 diabetes, making up to 8% of a diabetes diagnosis. As previously mentioned, type 1 diabetes is a condition in which pancreas produces little to no insulin, resulting in a high blood glucose level, and many cells require insulin for glucose uptake. In other words, we can say that insulin helps transfer glucose from blood into the cell. Okay, once inside the cell, glucose can then be used as a energy or fuel for the cell. So without insulin, glucose remain in the blood and blood glucose level increase. As a result, the elevated blood glucose level along with the inability of cells to take off the glucose results in number of symptoms. The onset of symptoms is generally very rapid, occurring in just a day to a week. So let's talk the sign and symptoms of a type 1 diabetes. That is a weight loss, polyuria. Polyuria means increase the urine output, frequent urinations, polydipsia. Polydipsia means increase the thirst, and dry mouth, fatigue, weakness, polyphagia, that means increase the hunger or appetite, blurred visions, tachycardia means increase the heart rate. So these are a common sign and symptoms of a type 1 diabetes. So undiagnosed patients may present in the emergency room with a diabetic ketoacidosis as a serious complication of a diabetes. So let's talk what are the causes of a type 1 diabetes. The causes of a type 1 diabetes development is not yet known. However, there are several theories to cause the type 1 diabetes. We can see here. So number one is the infections, and the type 1 diabetes could be triggered by the infections such as because of a virus. You can see the example of one virus is the cocci virus.
So number 2 is autoantibodies. So another theory links type 1 diabetes to autoantibodies against the beta cell antigens. So beta cell are responsible for producing the insulin, and the autoantibodies destroy the beta cells. So however, these autoantibodies are only present in the blood of 70 to 80% patients. So it cannot conclusive whether this relationship is a causative agents. Okay. So number 3 is genetics. So there may be also link with genetics with a strong associations between the type 1 diabetes and presence of SGLA-DR3 and SGLA-DR4 antigen on chromosome number 6. Okay, so these are some causative causes of type 1 diabetes mellitus. You can see in this chart. It is very nicely explained in this chart. Okay, so now we'll see the risk factor of type 1 diabetes. So there are several risk factors for developing a type 1 diabetes. Like number 1 is a family history. Family history of a type 1 diabetes will increase the risk of a relative developing it by 10 times. If one member has been affected by a type 1 diabetes, that will increase the 10 times. Okay, so next is the child risk of inheriting type 1 diabetes from their affected parents can vary between 1 to 9%. And also family history of other autoimmune disease like hypothyroidism, pernicious anemia, some kinds of a disease will also increase the risk of type 1 diabetes. Okay, now next is a environmental factor. If we see environmental factor in genetically susceptible individuals, some individual factors can trigger and the development of a type 1 diabetes like obesity. Okay, obesity, poor diverse gut microbiomes, diet, breastfeeding is possible association. So it is believed that breastfeeding is possibly associated with a low risk of the infant developing type 1 diabetes. So early introductions of cow milk to infants diet is a possibility associated with a high risk of developing a type 1 diabetes. So it is recommended that how much it is possible the mother should do a breastfeeding rather than using a cow milk, buffalo milk. So next is the early introduction of a cereal is also possibility associated with a high risk of developing a type 1 diabetes. And now next is the lack of vitamin D exposures. So it is recommended that regular dose of vitamin D early in life have been shown to decrease the risk of developing type 1 diabetes. So it is recommended that children, the infants who are growing stage, they should be recommended with a vitamin D syrup or vitamin D in their diets. So people in northern climate seems to be a very higher risk of developing type 1 diabetes than southern climates. So this is also one factor that may increase the risk of type 1 diabetes. So diagnosis rate of type 1 diabetes is also higher in winter months as compared to the lower in summer months. Okay, so these are some risk factor of type 1 diabetes. So now we'll talk how does the insulin works. Okay, once the beta cell of pancreas release insulin into the blood, insulin binds to the insulin receptor on the surface of body cells. So the binding of insulin to the insulin receptor on a cell activates a signaling cascade which increase the recruitment of a glucose transporter, that is a GLUT4, from intracellular storage vesicles to the plasma membrane. You can see in the figure. So GLUT4 is a major transporter responsible for uptake of glucose from the bloodstream into the cells. So an increase in a GLUT4 glucose transporter at the plasma membrane will increase the glucose uptake into the cell. The cell can then use the glucose as energy or fuel to carry out their functions. So you can see in this diagram also. Now we'll see the pathophysiology of a type 1 diabetes. So type 1 diabetes is an autoimmune condition in which the body immune system attacks its own pancreatic beta cells. So more specifically, the T cells of immune cells destroy the pancreatic beta cells in genetically predisposed individuals. As previously mentioned, the beta cells are involved in producing, storing and releasing the insulin. This autoimmune attack damages the beta cell, preventing them from the producing or releasing insulin. So without insulin, glucose cannot taken up from the bloodstream into the cell, and this result in elevate the blood glucose level called hyperglycemia. The kidney excrete the excess blood glucose into the urine, which can be detected as a glycosuria, also called as a glucosuria on urine dipstick. So you can see on this figure. So let's talk the diagnosis and test for a type 1 diabetes. So diagnosis of a type 1 diabetes involves the measuring blood glucose level through the one of the following methods. Number 1 is the hemoglobin A1C random blood glucose test, fasting blood sugar test. So hemoglobin A1C is a simple blood test that measures the patient's average blood sugar level over the past 2 to 3 months. We can say that 8 to 12 weeks. So it measures the amount of blood glucose attached to the hemoglobin. So if A1C level of 6.5% or higher or the two separate occasions suggest the diabetes. So let's talk about random blood sugar test. A blood sample can also be taken at a random to assess the patient's blood glucose level. So regardless of when the last meal was, and a blood glucose level of 200 mg per dl or higher could be suggestive as a diabetes. Now we'll talk about a fasting blood glucose test. A blood sample can be also taken after a period of fasting or to assess the blood glucose level. So fasting blood glucose level can be interpreted as a normal when it is less than 100 mg per dl. So it is a pre-diabetes, means there will be range between 100 to 120 mg per dl. So if there is a diabetes case, means there will be more than 125 mg per dl. You can see in the figure in this chart. So this was all about type 1 diabetes. In next video we'll talk about type 2 diabetes mellitus in more detail. Thank you for watching this video. Welcome guys in the second part of tutorials about diabetes mellitus. Type 2 diabetes is a metabolic disorder in which the body response to insulin is reduced, called insulin resistance. Type 2 diabetes is a condition caused by insulin resistance and decreased insulin secretion, resulting in high glucose levels. Many cells require insulin for glucose uptake. In other words, the insulin helps transport glucose from blood and into our cells. Once inside the cell, glucose can then be used as energy or fuel for the cells. These things we have already discussed in our previous type 1 diabetes. So without insulin, glucose remains in the blood and blood glucose level increases. So the elevated blood glucose levels along with the inability of cells to take off glucose results in number of symptoms. Now let's talk the sign and symptoms of a type 2 diabetes. So number 1 is a polyuria. Polyuria means increase the urine output, increase urinary frequency, polydipsia, polyphagia, unexplained weight loss, blurred visions, fatigue, recurrent urinary tract infections, recurrent skin infections, recurrent candida, yeast infections, we can say like that, darkening of skin around the neck, groin and axilla, armpits. We can say acanthosis nigricans. Parathysiasis means numbness, burning sensation, pickling sensations or tingling sensations, typically in hands, legs and feet. Slow healing of a cuts or sores. So these are important signs and symptoms of a type 2 diabetes mellitus. Type 2 diabetes typically has a slower onset than a type 1 diabetes, with symptoms developing over months to years, whereas the type 1 symptoms develop within days to weeks. Now let's see the risk factor for the type 2 diabetes. There are both modifiable and non-modifiable risk factor for developing type 2 diabetes. Let's talk about a first type of a risk factor, that is a modifiable risk factor, that is obese or overweight, low physical activity, unbalanced diet, pre-diabetes. Pre-diabetes means higher than the normal blood sugar level but not enough to be considered type 2 diabetes. Now we'll talk about a non-modifiable risk factor, that is a family history of diabetes, older than 45 years old, South Asian, Africans, Hispanic, American Indians and Caribbeans ethnicity, low birth weights, previous pregnancy with a gestational diabetes, history of polycystic ovary syndrome, we can say other metabolic disease also. So whatever the modifiable risk factor listed above are a cause of insulin resistance. So the genetic inheritance of a type 2 diabetes is very good, especially when compared to type 1 diabetes. A child who has one parent with a type 2 diabetes will have a 40% chances of developing a type 2 diabetes. So now we'll talk how does the insulin works. Okay, once the beta cell of pancreas release insulin into the blood, insulin binds to the insulin receptor on the surface of a body cells. So the binding of insulin to the insulin receptor on a cell activates a signaling cascade which increases the recruitment of a glucose transporter, that is a GLUT4, from intracellular storage vesicles to the plasma membrane. You can see in the figure. So GLUT4 is a major transporter responsible for uptake of glucose from the bloodstream into the cells. So an increase in a GLUT4 glucose transporter at the plasma membrane will increase the glucose uptake into the cell. The cell can then use the glucose as energy or fuel to carry out their functions. Now let's talk what are the causes of type 2 diabetes. Type 2 diabetes develops when the pancreatic beta cells secrete less insulin than the body requires, and the cells in the body stop responding to the insulin, which is known as insulin resistance. In other words, the type 2 diabetes is an insulin resistant condition which associated with the pancreatic beta cell dysfunctions. So it is suggested insulin resistance can be caused by a metabolic syndrome like a high blood glucose level, low level of SDL, high level of triglycerides, high blood pressures. And next is obesity. Adipose tissue promotes the insulin resistance through the inflammatory mechanisms. And next causes is a lack of exercise, poor diet, genetics. If we see in genetics, abnormal gene functioning can lead to insulin resistance or a pancreatic beta cell dysfunction. Now we'll talk about pathophysiology. Both insulin resistance and inadequate insulin secretions must be present for type 2 diabetes to occur. So in type 2 diabetes, the insulin receptors on a cell surface become resistant to insulin. This means that glucose cannot be taken up into the cell from the bloodstream. It becomes deprived of glucose and blood glucose level inappropriately rise. So more simply, the blood glucose is full of sugar, but sugar cannot enter the cells due to the reduced insulin resistance and eventually overall lack of insulin. To compensate for insulin resistance and to maintain normal glucose level, the pancreatic beta cells will initially increase the insulin synthesis and release. The increase in insulin production and secretion is temporary fix to overcome the lack of sensitivity of insulin and allows the body cells to take off glucose. However, the increase in insulin production and secretion will eventually lead to accelerated beta cell changes or damage. Simply put, the pancreatic beta cells tired out and do not make as much insulin. This will cause a subsequently decrease in insulin production and secretion. When the levels of insulin secreted by beta cells are not enough to compensate for the lack of sensitivity of insulin receptors, the patients will begin to experience symptoms of diabetes. So let's talk the effects on the liver. The combination of insulin resistance and inadequate insulin secretion leads to a further increase in blood glucose levels by the liver. As insulin is not recognized by insulin receptors on the liver can no longer take glucose off from the blood to store it. This causes the liver to inappropriately respond as if blood glucose level is low, resulting in an increased gluconeogenesis and glycogenolysis. So let's talk about what is gluconeogenesis. The formation of a glucose in liver is known as a gluconeogenesis, and the breakdown of a stored glycogen in liver release a glucose into the blood, that is glycogenolysis. So both processes increase the blood glucose level. So this was the effect on the liver because of insulin resistant. Now let's talk about diagnosis and test for type 2 diabetes. So diagnosis of type 2 diabetes involves measuring a blood glucose level through one of the following: HbA1c, fasting blood glucose test, oral glucose tolerance test, random blood glucose test. Patients with symptoms of diabetes may only require one biochemical test to confirm their diagnosis of type 2 diabetes. However, patients with no symptoms typically require two separate investigations on different occasions. Both tests must have results with which confirm the diagnosis of type 2 diabetes. The investigations and outcomes are shown as on table that you can see on my screen. Let's talk about a hemoglobin A1c or HbA1c test. HbA1c test is a simple blood test that measures the patient's average blood glucose level for the past 2 to 3 months. It measures the amount of glucose attached to the hemoglobin. HbA1c does not require the patients to fast. HbA1c level can be interpreted as a normal if it is less than 5.7% and pre-diabetes if it is between 5.7 to 6.4% and diabetes if it is higher on two separate occasions, that is about 6.5%. HbA1c is affected by red blood cells turnover, therefore should not be used diagnostically in patients who have pathologically affecting these cells such as hemoglobinopathies, hemolysis, ongoing iron deficiency anemia or HIV. And most important thing is that HbA1c is not recommended in pregnant patients. Now let's talk about a fasting blood glucose test. A fasting blood glucose test is a blood test that checks checks the blood glucose, any food or drinks for at least. Patients usually begin a fasting at midnight and have a blood test performed. Fasting blood glucose level can 100 to 125 mg per dl, and diabetes if it is more than 126 mg per dl. Now let's see about oral glucose tolerance test. The oral glucose tolerance test involves taking a fasting blood glucose level first, followed by patients drinking on beverage containing 75 mg of glucose. The blood glucose is then measured again 2 hours after drinking the sugary beverage to analyze how the blood sugar level has changed. So this test is more commonly used to test pregnant patients. A 2 hours glucose level of less than 140 mg per dl is recommended as a normal. If the range is between 140 to 199 mg per dl and it's said as a patient is having a pre-diabetes conditions, and if it is more than 200 mg per dl, the patient is said to be a diabetes. Now let's talk about a random blood sugar test. A random blood glucose test is also known as a random plasma glucose test. It is a blood test that checks the blood sugar level at any random time regardless of when last meal was taken. A patient is said to be diabetes if the range is about 200 mg per dl or higher. Let's talk about some other tests for type 2 diabetes. On investigation of type 2 diabetes, the patient should also have their lipid profile tested as a urine analysis performed to check for proteinuria. If ketones are present in the urine, it may indicate the patient has a type 1 diabetes. Also, it is recommended to patients for a renal function test and liver function test for diagnosing of diabetes. This was all about type 2 diabetes. Thank you for watching this video.
Hello guys, Namaste. I am Gautam Prasad Chaudhary and today we'll be